Welcome to the State of Mind Virtual Speaker Series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hello there, and thanks for joining me today for this State of Mind speaker series presentation that's being brought to you by 1 in 5 and MindPeace. I have to say it feels a little awkward because I'm a person who gives talks all the time, but talking towards a screen is a little bit tricky, but hopefully I will get past that quickly. And I just gave a talk for teenagers that hopefully has me kind of warmed up. My name is Stuart Slavin. I'm a pediatrician, practiced for 21 years. But over the last 10 years or so, I've changed my focus to physician well-being. And I'm currently senior scholar for well-being for an organization by the name of the Accreditation Council for Graduate Medical Education, or the ACGME. And what I'm going to talk about today is teen mental health, looking at sources of stress and distress, and implications for change. So a little bit more about me. I joined the ACGME 2 years ago, and as I said, my focus is on physician well-being. But when I joined them, one of the things I negotiated, actually the only thing I negotiated, I'm not a good negotiator, is I asked them for at least 15% time to work on adolescent and young adult mental health. And unfortunately, they granted that time to me. And over the last 2 years, what I've done with that time is conducted surveys of now 11 high schools, first in California, but then in Missouri, and now most recently in Ohio, looking at teenagers' mental health, specifically high school students' mental health, and examining their lives. And that's going to be the focus of the presentation today in large part, is what were the findings in these studies, and what are the implications for what we can do to improve mental health of teenagers today. So these studies, I'm going to give you a quick overview of what we looked at and then kind of dive a little bit deeper into each area. So we really looked at 4 different areas. The first was just mental health outcomes themselves. So we used very well validated screening tools for depression and anxiety. Second, then, what we looked at was how students spend their time. You know, how much time doing homework, how much time in extracurricular activities, importantly, how much time sleeping. Third, we had them rate the impact of various stressors in their lives, and we'll dive into that. But the stressors were wide-ranging, from school to family to relationships to peers, etc. So that was the third. But then the fourth one was one that actually came from my work with medical students originally. And that's looking at what I kind of term mindsets, or kind of mental filters that teenagers may have, and the mental models that they bring to their experience of life, that may have a significant impact for some on their own well-being. So that's the overview, and we'll jump into it and start with talking about the levels of depression and anxiety. And I'm going to start with the bad news, which was what we found, kind of surprising to me when I started looking at this. We found depression and anxiety rates that were higher in every single school than are seen in medical school and residency, which of course are incredibly demanding periods of life for people. But no, we saw depression and anxiety rates that were actually higher. The good news is, of all the schools I've looked at, actually the best mental health outcomes were in schools in Ohio. California and the St. Louis schools that I looked at were significantly worse. But in my opinion, and I think many people would feel the same way, if not all people would feel the same way, is that they're still too high, with substantial numbers of students suffering from depression and or anxiety. You know, not in the single digits or low teens. I mean, this is likely a majority of students experiencing depression or anxiety or both. And that's something that I hope that people would just not find acceptable, and would really spur action. So that's the first piece of the survey. The second piece of the survey, which was really interesting, is how teens are spending their time. And of course, this is self-report, so may not be entirely accurate, but what it shows is the following: is average amount of time in the Ohio schools spent on homework was 2.2 hours. And actually that's less than the California schools and the St. Louis school. So less demands than we see in some places, but still significant. If you look at extracurricular activities, which may be sports or drama or interests like that, or jobs, it was 2.7 hours on average. What you find, if you look at just homework and extracurricular, the average kid is spending, close to 5 hours during weekdays on those extra activities. So combined with school, I mean, they're putting in really full days. And one of the implications of that, one of the byproducts of that, appears to be their sleep. And I think of all the data in terms of hours that they're reporting, this is the one that, for me as a pediatrician, is most concerning, which is the average amount of sleep that students reported was on weeknights was 6.7 hours. So a majority of kids were getting less than 7 hours of sleep a night. And what you need to know is that's a sleep deficit that's profound. American Academy of Pediatrics says they should be getting 9 to 9.5 hours. So when you're getting less than 7 hours of sleep, even if you're getting 7 hours of sleep as a teenager, you are going to be cognitively and emotionally compromised. So one of the things I think we tend to go is when teenagers, they're moody, they're having a tough time, they're arguing with you all the time, and we say, oh, it's teen hormones. Well, it may be teen hormones, but it may be also just a sign of sleep deprivation. They're just exhausted. And you can't, they try to catch up on the weekends, but you can't catch up on sleep deficits and still be as functional as you would be if you were actually getting really good night's sleep consistently. So that's the sleep picture. That's the hours in the day picture. Let's turn our attention to the stressors. What are the stressors that they're feeling, and what are the biggest ones in their lives? So we asked them probably about 30 stressors, and it was different aspects of school, right? So, the amount of homework, competition for grades, pressure to get into a good college, sources of pressure from individuals, from parents, from teachers, et cetera. More socially based ones, do they feel ignored or excluded by friends? Are they being bullied or cyberbullied? And then family relationships, we're difficulty with relationships with family members, or family circumstances that are causing distress, economic issues, things like that could be causing problems, illness in a family member. And the findings were really striking. And what we found was the following. The biggest stressors, I'm not going to name the top stressor first. I'm going to hold that one for a second. But the other than the top stressor, the top stressors were as followed. So first was time pressure. Second was pressure to get into a good college. Third was pressure to not disappoint my parents, which was actually very interesting. It wasn't pressure from parents. It was pressure to not disappoint parents. The amount of material I need to learn, the amount of homework, fear of failing a course, fear of failing an exam. And I think what's most striking about those is they're all school related. They're all school related. And what was kind of most remarkable and most striking, as I said, I didn't say what the number one stressor. The number one stressor was pressure from self. So what what kids are doing, what teens are doing, is they're absorbing all of these messages that are coming at them from the environment, um, from the culture related to school. And they're internalizing it so that the biggest source of pressure and stress is from themselves. And it's significant. It's significant. These are not inconsequential stresses. I mean, if their mental health was great, I wouldn't be so worried about it. And what you need to realize is a little stress, a little pressure is fine, but the pressure they're facing is enormous. And I have to say, my sense is it's getting worse and worse and worse. Over the last 10 years, I think we've seen an acceleration of this. And what I also have to say is that I think a lot of people who are responsible for placing that pressure on the kids, whether it's teachers, coaches, parents, et cetera, are doing it from a space that they want what's best for their kids. But what we have to realize is that pressure itself is actually likely causing significant damage to their mental health. Interesting. The lowest stressors, and it doesn't mean that some individuals aren't disturbed by these things or stressed by these things. But if you look at the population, these were the lowest rated stressors. Social media, low rated stressor. Feeling bullied or cyberbullied, low rated stressor. So there's a narrative out there, if we could just get kids off their iPhones and off the video games and off Snapchat and Instagram, they'd be fine. No, it's not. Not at least if you ask the kids themselves. It's school and school culture which is creating it. And as I say that, one of the things is to say, like, I'm not pointing blame at anybody, because we've all built this culture. And sometimes when I work with schools, it's like everybody wants to point fingers. Teachers say, it's the helicopter parents, and the parents go, it's the unreasonable teachers. No, we all have to own our part of it in some sense. And the only way we're going to dismantle is if we work together on this problem. The last aspect of the survey, and really this was a focus of the talk that I just prepared for the teenagers themselves, is kind of these mental models and mindsets. And we actually measured those, and I'll tell you a little bit about what we found. What we found is just really relentless comparison to others, and a sense that you only feel good about yourself if you're doing better than others. So that's number one. The second one is perfectionism, and that is just really widespread. Is kids in all of these different schools have very high standards for themselves. And what we found is that there's something called maladaptive perfectionism, which means always feeling like what you're doing is not good enough, like not measuring up. And it's actually something that we can measure, and we actually measured in the survey. And we found very high rates of this maladaptive perfectionism. And then the last thing that I want to mention that we looked at was emotions that were connected to their academic performance. So we asked them about, pride and feeling of competence and things like that. But we also asked them if they felt inadequacy, embarrassment, or shame about their academic performance. And not a majority, but significant numbers felt inadequacy, embarrassment, or shame. And what's interesting about all of this, and why this stuff matters, these mindsets, is that every one of those that I just mentioned, maladaptive perfectionism, comparison, those negative feelings about performance, all of them in the survey were strongly correlated. With depression and anxiety. So that if you had those mental models, you're much more likely to be depressed or anxious. Now, we can't prove causation, right? All we can say is correlation, that these two kind of travel together. But it's hard not to think that if you're perfectionistic, if you're comparing yourself to somebody all the time, that is not going to contribute to depression and anxiety. What's a little tricky, though, at least for depression especially, and probably for anxiety as well, there's also this positive feedback loop that as you get more depressed, you're thinking about your self-worth, et cetera, suffers, and there's this kind of positive feedback loop that kind of reinforces these whole things, and can actually make your depression even worse. So, what I've described is frankly a pretty disturbing picture. And as a pediatrician, I have to say that it causes me pain to see it. And a little more history about myself. My daughters were both injured. They're young adults now, and they're doing well now, but they were injured in the process of their education. I was actually on the school board, and I pushed them to change, and I failed. I failed. I lost the battle, but what I said is, like, I may have lost that battle, but I'm not going to give up the fight. And so I continue to work on this issue, and hopefully we'll start seeing change across the country, because it's desperately needed. So the question is, what can we do about it? And what I think is striking for me is, I don't think it has to be too difficult. And it's really informed by work that I did at St. Louis University School of Medicine, where I was a curriculum dean back in the early 2000s, and started on a project where basically we saw mental health of our med students was hugely problematic. And we started a really simple approach, which was kind of what I think we should be doing with teenagers in high school, is we just reduced demands. We cut back on curricular time. We cut back on curricular content, about 10% for each. So it wasn't like we slashed it. We freed up time for them, and lowered the expectations in terms of just how much information that they would be expected to absorb. And then the others, we had a really brief resilience curriculum. An hour and a half in the first year was basically it, and with a little reinforcement in the subsequent 3 years. So it wasn't a huge, massive resilience curriculum, but what was intriguing about it is just those changes, essentially. I mean, there were some modest changes beyond, but those changes reduced depression and anxiety rate by 80 to 90%. 80 to 90%. So that by the time I left St. Louis U, actually the first year classes were ending their first year of medical school with mental health better than when they arrived, which is pretty striking. Their depression rates dropped from like 30% down to 6%. Their anxiety rates dropped from 60% down to 15%. I mean, not only were they avoiding mental health problems, they were flourishing. And I really do believe the same is possible. So one of the most important things we can do is like reduce the pressure, reduce the time demands. And what's striking about that, everybody's afraid, oh, if you reduce the time demands, the content, if we teach them less, they'll actually, their performance will suffer. I think the sweetest part of what my work at St. Louis U was, it wasn't just mental health that improved. Their academic performance improved as well. Their performance on the national board exam that everyone takes actually went up, and their failure rate dropped. People were surprised. Oh, how can you cut content and have people's performance actually improve? Well, if you're depressed or anxious, you're not going to be very effective with your learning. And actually, the idea that the more we teach, the more they'll learn is just not the case. If you have kids that are in really pressured environments, they'll learn something for a Friday, but like, they'll stuff the information into their brain, but 3 months later, a lot of it's gone. So I think we can cut back and actually in high school, and not only improve mental health, I think we can actually improve academic performance. So that's number one. The second thing that we need to do, that I was really talking in my previous talk to the teenagers about, was giving them some resilience skills so that they can manage these mindsets in ways that are just more accurate and more functional, so that they aren't beating up on themselves all the time. And underlying all of this, frankly, is this kind of relentless pursuit, I think, of the elite college or the good college. And one thing that you need to know as parents and teachers, administrators, coaches, et cetera, is the evidence that supports the idea that the more elite the college is that you go to, the greater the likelihood of success is just that the evidence of that is just scant to non-existent. And so there's a great book actually by Frank Bruni called Where You Go Is Not Who You'll Be, that really goes through the evidence to say, no, you know, the college you go to isn't as nearly as important as what you bring to it. Who you are, that's going to define your success. So what I think is fueling a lot of this push is this idea on the part of parents and kids that, oh my gosh, I better get my kid into the best college possible, or their life is going to be forever compromised. And it's just a myth, an absolute myth. So read that book if you can. Frank Bruni, again, Bruni, available, you know, anywhere. So this is primarily an environmental problem. We also have to help them with the mindsets. And honestly, you as parents, teachers, et cetera, I think would benefit from knowing what those mindsets are, and then how to talk to the kids you care about in a way that can help them work within those mindsets, change their mindsets so that they're not so distressing, so that they aren't feeling these profound levels of shame, embarrassment, or inadequacy about themselves, so that they aren't viewing their academic performance as their identity. And that's going to be actually the focus of a webcast that I'm going to be doing in late October. So if you find this helpful, tune in for that one as well. I think that's it. The message is simple. And ultimately, it's even though I think it's a difficult place we're all in, and it hasn't been made easier with COVID and everything else going on in this country. But I really do believe change is possible. But I also believe there's kind of a moral imperative to do something about this and not, I mean, the status quo to me is just unacceptable. So my hope is that schools in Ohio will really step up and implement real change to help kids. So thanks for spending time with me today. I'm sure your lives are incredibly busy as well, and that you took the time to listen to this. I really appreciate it. Be sure to visit the 1 in 5 and MindPeace websites. There are other great resources available there and more state of mind videos. So continue to explore this world, and best of luck with your kids in these challenging times. Take care. Thanks.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.